over something that is called check, call, care. We see a victim who could potentially be unconscious. We want to check our environment, make sure it is safe for us to approach her. Then we're going to come down to the victim. We're going to say, can you hear me? We're going to physically touch the victim. Sometimes they can be hearing impaired. We get no response. We know that they are unconscious. We're going to do something that is called a head chin tilt. Check for the carotid artery, check for pulses, and then we're going to look, listen, and hear for her breathing. So we're going to come down, we're going to hear to see if she's breathing, look to see if she's breathing, also feel to see if she's breathing. You're going to do this for about 10 seconds, which determine that she is unconscious. We're going to grab somebody's attention, have them call 911, and then perform care, which is again going to be our CPR. Hey guys, this is my victim that's going to help us with the rescue breathing. My daughter, she's going to laugh during the whole thing. So Mr. Monkey is going to help us out today. And what we're going to be learning today is what is called rescue breathing. And what that is giving rescue breaths to a victim who has a pulse but is not breathing. So to check for pulses, 2 fingers, carotid artery. Don't use your thumb because your thumb has pulses and that's what you're going to be feeling versus theirs. We're going to do a head chin tilt method, and then you're going to have a barrier here. Well, what this barrier does is help protect us against bloodborne pathogens. You're going to put it over their mouth. Make sure you have a good seal when you do this. Head tilt, give 1 breath, and your breath is going to be about 1 second long. You're going to watch that chest rise, and with that, you want to stop when it gets to the top. We don't want to cause any injury to the victim if they're smaller than us. So you're going to do 1 breath every 3 seconds. So let me demonstrate. So 1, 2, 1, 2. And on that 3rd count is when you're going to give that breath. You're going to do continuous rescue breathing for about 1 minute. Thank you. So today we are going to be learning CPR. You still want to do your check, call, care, check your environment, make sure it is safe for you to approach, check the victim, make sure they are unresponsive, and then determine if they're unresponsive, and they are. Have someone call 911, and then you're going to then perform your CPR. So when you perform CPR, you're going to put 2 hands over the chest, and you're going to press down. And you want to go as far as 2 inches on the chest. And you're going to do 30 presses in about 18 seconds. And then when you're done with your 30 presses, then you want to do 2 rescue breaths in between. So you're going to do your head tilt, hold the nose, create a seal around the mouth. You're going to do, and then you're going to continue to do your chest presses like so. Okay, so when you do CPR, you want to do CPR until you are physically exhausted and can no longer perform it anymore, until your environment becomes unsafe for you to perform CPR, and or someone equally skilled or trained is able to switch out with you. That's how long you want to perform it for. Thank you. So we are going to continue CPR until an AED is available. If somebody is with you, then they can go grab an AED. If you are by yourself and an AED is very in close range, then you can go grab one. If it is far, continue to do CPR until EMS comes. So most AEDs have the same setups. You're going to turn it on. You're going to bare the chest. You want and wipe it down. So you want the chest dry. They could be sweating or they could be wet from a pool or anything like that. So you want to make sure the chest is dry. You're going to shave the upper right and lower left where you're going to put your pads on. So you're going to place them upper right, lower left. You do not want to place your pad in the upper left in case there's a pacemaker or anything that it can interfere with. You're going to steer clear, make sure there is no interference, and then it's going to analyze. And once it's done analyzing, it'll say shock or no shock. So if it says shock, steer clear, it'll give it a shock. Then you're going to check for signs of life. If there are no signs, you're going to continue to do CPR. If there are signs of life, then you are going to roll into the rescue position and stay with that victim until EMS arrives.